Stop scrolling. Are you tired of stubborn blackheads that keep coming back no matter what you try? Before you touch your face again, listen carefully. I am dermatologist Dr. Sandra Lee explaining what you must stop doing today. Blackheads are one of the most common skin concerns seen in dermatology clinics worldwide. They are a type of acne medically known as open comedones. Unlike whiteheads, which remain closed under the skin, blackheads occur when a pore becomes clogged with a mixture of sebum, dead skin cells, and keratin. When this material is exposed to air, it oxidizes and turns dark, which is why blackheads appear black on the surface of the skin. Many people believe the dark color is caused by dirt trapped in the pore, but that is not true. The black color comes from oxidation of melanin and lipids within the pore, not pore hygiene. One of the biggest mistakes people make when dealing with blackheads is overwashing their face. It may seem logical to wash more often if your skin feels oily or clogged, but excessive cleansing actually damages the skin barrier. The skin barrier is the outer protective layer made of lipids and cells that keep moisture in and irritants out. When you wash your face too frequently or use harsh cleansers, the skin becomes dry and irritated. In response, the sebaceous glands increase oil production to compensate for the dryness. This extra oil can mix with dead skin cells and create more clogged pores, which ultimately leads to more blackheads. Dermatologists typically recommend washing your face twice daily with a gentle, non-comedogenic cleanser to maintain balance. Another common mistake is squeezing blackheads aggressively with fingers or metal tools. While it might feel satisfying to extract them immediately, improper extraction can damage the follicle wall and surrounding tissue. This trauma can lead to inflammation, post-inflammatory hyperpigmentation, and even permanent scarring. Dermatologists are trained to perform extractions safely using sterile tools and proper pressure techniques. At home, instead of squeezing, it is safer to use chemical exfoliants that gradually dissolve the buildup within pores. Using pore strips too frequently is another habit that can worsen blackheads over time. Pore strips work by adhering to the oxidized material in pores and pulling it out when removed. While they may provide temporary improvement, they do not address the underlying cause of blackheads, which is excessive oil production and abnormal keratinization within the follicle. Frequent use can irritate the skin, enlarge pores, and weaken the surrounding tissue. Dermatologists generally advise limiting pore strip use and focusing on ingredients that regulate oil and cell turnover. One of the most effective ingredients for blackheads is salicylic acid. Salicylic acid is a beta-hydroxy acid that penetrates deep into the pore because it is oil-soluble. This allows it to break down the mixture of sebum and dead skin cells that forms comedones. Studies in dermatologic research show that regular use of salicylic acid, in concentrations between 0.5% and 2%, can significantly reduce blackheads and prevent new ones from forming. It also has mild anti-inflammatory properties, which makes it helpful for acne-prone skin. Retinoids are another scientifically proven treatment for blackheads. Retinoids are derivatives of vitamin A that regulate skin cell turnover and prevent the buildup of dead cells within pores. They also help normalize keratinization inside hair follicles, which reduces the formation of comedones. Over-the-counter retinoids such as adapalene have been shown in clinical trials to improve comedonal acne when used consistently for several weeks. Prescription retinoids like tretinoin or tazarotene may be recommended by dermatologists for more persistent cases. Excessive exfoliation is another mistake many people make. Social media trends often promote scrubs, brushes, and strong chemical exfoliants used daily, but this can disrupt the skin barrier and trigger inflammation. When the skin barrier becomes compromised, it can lead to increased oil production and clogged pores. Dermatologists recommend gentle exfoliation 2 to 3 times per week, rather than aggressive daily scrubbing. Chemical exfoliants such as salicylic acid or mild alpha-hydroxy acids can provide controlled exfoliation without causing micro tears in the skin. Heavy or comedogenic skincare products are another contributor to blackheads. Many moisturizers, sunscreens, and makeup products contain oils or waxes that can block pores, especially in individuals with oily or acne-prone skin. Dermatologists advise choosing products labeled non-comedogenic, oil-free, or formulated specifically for acne-prone skin. Ingredients such as dimethicone, hyaluronic acid, glycerin, and niacinamide provide hydration without clogging pores. Niacinamide has become a popular ingredient in dermatology because of its multiple benefits for acne-prone skin. It helps regulate sebum production, reduces inflammation, and improves the skin barrier. Research has shown that topical niacinamide can reduce oiliness and improve overall skin texture when used consistently. This makes it a helpful addition to a skincare routine aimed at controlling blackheads. Clay masks are another useful option for people with oily skin and frequent blackheads. Ingredients like kaolin and bentonite clay absorb excess oil from the skin's surface and help draw impurities out of pores. While clay masks can help temporarily reduce oiliness, they should not replace daily skincare treatments that address the root causes of blackheads. Sun protection is also essential when treating blackheads and acne. Many acne treatments increase skin sensitivity to sunlight. Without proper sun protection, this can lead to irritation and hyperpigmentation. Dermatologists recommend using a broad-spectrum sunscreen with SPF 30 or higher every day, even for oily or acne-prone skin. Gel-based or oil-free sunscreens are usually best for people prone to blackheads. Diet may also play a role in acne and blackhead formation for some individuals. Research suggests that high glycemic index foods such as sugary snacks, white bread, and processed carbohydrates may increase insulin levels and stimulate sebum production. Dairy products, particularly skim milk, have also been associated with acne in some studies. While diet alone does not cause blackheads, maintaining a balanced diet rich in vegetables, fruits, lean proteins, and healthy fats may support overall skin health. Hormonal fluctuations are another factor that can influence blackhead formation. Increased androgen hormones stimulate sebaceous glands to produce more oil. This is why many people notice more blackheads during puberty, menstrual cycles, or periods of stress. Dermatologists sometimes prescribe hormonal treatments or oral medications in severe cases of acne to regulate these effects. Professional treatments can also help manage stubborn blackheads. Dermatologists may perform manual extractions using sterile tools in a controlled environment. Chemical peels containing salicylic acid, glycolic acid, or lactic acid can help exfoliate the skin and reduce comedones. Microdermabrasion is another treatment that removes dead skin cells from the surface and can improve overall skin texture. For individuals with persistent comedonal acne that does not respond to topical treatments, dermatologists may prescribe oral medications. These may include antibiotics to reduce inflammation or isotretinoin in severe cases. Isotretinoin works by shrinking sebaceous glands and dramatically reducing oil production, which helps prevent clogged pores. However, this medication requires careful medical supervision due to potential side effects. Consistency is one of the most important factors in treating blackheads. Many people try a product for only a few days and expect immediate results. In reality, most acne treatments require several weeks to show noticeable improvement because skin cell turnover takes time. Dermatologists typically advise patients to follow a routine consistently for at least 6 to 8 weeks before evaluating results. A simple dermatologist-approved routine for blackhead-prone skin often includes a gentle cleanser in the morning and evening, a salicylic acid or retinoid treatment to keep pores clear, a lightweight moisturizer to maintain the skin barrier, and daily sunscreen for protection. This balanced approach helps control oil, prevent clogged pores, and maintain healthy skin without causing irritation. It is also important to avoid touching the face frequently throughout the day. Hands carry bacteria, oils, and environmental pollutants that can transfer to the skin and contribute to clogged pores. Small habits such as resting the face on hands or picking at the skin can worsen blackheads and lead to inflammation. Cleanliness of items that come into contact with the face is another factor many people overlook. Makeup brushes, pillowcases, and mobile phones can accumulate oil, bacteria, and dead skin cells over time. Dermatologists recommend cleaning makeup brushes weekly and changing pillowcases regularly to minimize buildup that can contribute to clogged pores. Stress can also influence skin health. Elevated stress levels increase cortisol, a hormone that can stimulate oil production in the skin. This may lead to increased breakouts and blackheads. Managing stress through sleep, exercise, and relaxation techniques can indirectly support healthier skin. Ultimately, blackheads are a very common and treatable skin condition, but they require patience and the right approach. Instead of aggressively trying to remove them with squeezing, harsh scrubs, or excessive washing, focus on ingredients and habits that support healthy skin function. Gentle cleansing, controlled exfoliation, oil-regulating ingredients, and consistent sun protection are key components of effective blackhead management. When blackheads become severe or persistent despite proper skincare, consulting a board-certified dermatologist is the best course of action. Dermatologists can evaluate skin type, identify underlying causes, and recommend targeted treatments that are both safe and effective. With the right strategy and consistent care, it is possible to significantly reduce blackheads and maintain clearer, healthier skin over time.